Understanding mesothelioma types and stages. Introduction. Mesothelioma is a rare cancer that develops in the mesothelium, a thin layer of tissues that lines many of the bodies. The most common type of mesothelioma is a pleural mesothelioma, which affects the lining. Other types of mesothelioma can affect the lining of the abdomen, periocean mesothelioma, heart, and other. Mesothelioma is caused by exposure to asbestos, a group of naturally occurring minerals that were once widely used. When asbestos fibers are inhaled or ingested, they can damage the mesothelioma. Symptoms. The symptoms of mesothelioma can vary depending on the type of mesothelioma and the stage. Common symptoms include cough, shortness of breath, chest pain, fatigue, weight, fever, night sweats, lump in the chest. Shortness of breath. Causes. The main cause of mesothelioma is exposure as asbestos, a group of naturally occurring minerals that were once widely used in construction. When asbestos fibers are inhaled or ingested, they can damage the mesothelioma and lead to the development of the mesothelioma. Asbestos exposure can occur in a number of ways, including working in an industry where asbestos was used, such as construction, shipbuilding, or manufacturing. Living near that area. Being exposed to asbestos containing products such as insulation, brake pads, or other. Being exposed in asbestos containing dust from old buildings or home, the risk of developing mesothelioma increase with the amount of pride. People who have been exposed to the high levels of asbestos are the much high risk of the developing the disease that can those who have exposed. There are other factors that can increase the risk of developing mesothelioma. Gender, family history, smoking increase the risk of developing mesothelioma by 2. The risk of developing mesothelioma is also higher in men than in women. And people who have a family history of mesothelioma are at increased risk of developing the disease. Stages. Mesothelioma has 4 stages. Stage 1, the cancer is confining in the lining of the lung or other affected organs. Stage 2, the cancer has spread to the nearly lymph nodes. Stage 3, the cancer has spread to the nearby tissues or organs. Stage 4, the cancer has spread to distant organs or tissues. The stage of mesothelioma is determined by a number of factors, including the size and location of the tumor and extent of the cancer, and the presence of lymph node involvement. The stage of mesothelioma is important because it has helped doctors to determine the best course of treatment. The prognosis for the mesothelioma varies depending on the stage. People with stage 1 mesothelioma have a better prognosis than people with the later stages. The average survival rate for the people with mesothelioma is about 12 to 21 months. However, some people with mesothelioma can live for many years with the disease. Complication can raise because malignant pleural mesothelioma itself, the surgery is associated with extremely high morbidity, and some of these complications include myocardial infarction, dependency on the ventilator, bronchial air leak, wound infection, renal failure from hyspelinium. Treatment. There is no cure for mesothelioma, but there are treatments that can help to relieve symptoms and improve quality of life. Treatment option for mesothelioma include surgery. Surgery may be used to remove the tumor or if it is small and confirm in the lining of the lung. Chemotherapy. Chemotherapy uses drugs to kill cancer cells. Chemotherapy may be used alone or in the combination with other treatments. Radiation therapy. Radiation therapy uses high energy beams to kill cancer cells. Radiation therapy may be used alone or in the combination with other treatments. If you have been exposed to asbestos, or it is important to see doctor for a regular checkups. Early detection and treatment can improve the chances of survival for people with mesothelioma. Here are some tips help you to reduce your risk of developing mesothelioma. Avoid exposure to asbestos. If you have been exposed to asbestos, wear or respirator when working with asbestos. Wash your clothes and shoes thoroughly after wearing everything. Do not smoke. Smoking increases your risk of developing mesothelioma. Eat a healthy diet and exercise regularly. A healthy lifestyle can help to reduce your risk of developing cancer. Conclusion. In conclusion, mesothelioma is a rare and aggressive cancer that is caused by exposure to asbestos. There is no cure for mesothelioma, but there are treatments that can help to relieve symptoms and improve quality of life. If you have been exposed to asbestos, it is important to see a doctor for our regular checkups. Early detection and treatment can improve the chances for survival for people with mesothelioma. Prognosis of mesothelioma. Mesothelioma is an aggressive form of cancer with a poor. The survival rate for mesothelioma patients is typically very low, with most patients surviving 1 year or less after diagnosis. Some patients may live for up to 5 years with a combination of surgery, radiation, and chemotherapy. Coping with a mesothelioma diagnosis, the diagnosis of mesothelioma can be overwhelming. Thank you.